Good afternoon, everybody. Good afternoon. I'm very grateful to see so many of you here today as we celebrate the 50th anniversary of Cook County Health's Prieto Health Center and mark 50 years of community-centered health care. All right, so before we begin, I'd like to acknowledge a few folks who are with us, starting with Congressman Garcia to my right. We're very grateful to have you here, Chewy. Thank you so much. All right, Commissioner Anaya, who's Vice Chair of Health, has joined us. I should have asked for applause at the end, all right? So let's wait till everybody else is announced, and then a round of applause. Dr. Eric Makaitis, who's CEO of our Cook County Health System. Claudia Burchinell, Executive Director of Ambulatory Primary Care Operations. Dr. DiBiase, Family Medicine Physician at this clinic. Carmen Prieto, representing the Prieto family. Adelita Benitez, a patient at Prieto Health Center, and Andrea Munoz, a member of the Community Advisory Council. So thank you to all of the folks who have joined us. Now, before I begin my remarks, I want to apologize. I made a commitment to my daughter that I would be back with her at 5:15. And if I don't keep my commitments to my kids, I'm in a lot of trouble. So I'm going to give my remarks, and unfortunately I have to leave right afterwards. But it's not, please take it as no disrespect. It's trying to keep peace at home. All right. It's particularly significant that we're here today at Prieto as we mark the anniversary of health clinic services. Dr. Prieto dedicated his career, his life, to increasing access to care for his patients, particularly for immigrant communities. And at a moment when in this country we're snatching people off the streets and sending them to gulags in foreign countries, it's really important that we acknowledge the work of somebody like Dr. Prieto. He transformed how public health care was delivered in Cook County, ensuring that it was accessible and inclusive for all. His work and his legacy are why we stand here today in a clinic named in his honor, and I'm grateful to the members of his family who are here today to help us celebrate. His work is also why we stand here celebrating clinics while remaining resolute in spite of federal threats and budget cuts that threaten to deny services to our residents. And let me just say, for 180 years, our health and hospital system has delivered care to whoever comes to our door, and we will continue to do that in spite of the challenges that we face. Community health centers are the backbones of healthcare in this country and the cornerstones of our communities, providing a huge range of critical services. They strengthen our communities, addressing not only the physical or mental health concerns of our residents, but also the roots of these diseases. It's a testament to the doctors, nurses, and all the staff here at Cook County Health that people feel at home in our clinics. And that's the legacy of Dr. Prieto. We can't turn our back on his legacy and the progress we continue to make toward health equity in Cook County, regardless of the federal challenges. And despite those challenges, and there are many, we want to work to ensure that no one is left behind in their healthcare journey, ensuring that the mission of Cook County Health and Dr. Prieto can continue for generations. So I thank all of you for joining us here today, and again, I apologize for the fact that I have to depart. I'm going to leave you in good hands, however. The Vice Chair of the Health and Hospital Committee of our Board of Commissioners is Commissioner Anaya, and she has joined us. Commissioner.
Thank you, Madam President. Good afternoon, everyone. How exciting is this today? Are we excited? 50 years. Great, great. My name is Alma Naya. I have the honor to stand with you today as we celebrate this remarkable milestone of 50 years of service, community, and well-being. I'm especially honored to welcome you here to the 7th District. This clinic is the only one in the 7th District. It is a pillar and oftentimes a point of conversation in a lot of our health task force meetings that we hold in the 7th District. I serve as commissioner here in this area, and I'm deeply proud and profoundly moved to be celebrating here with you today Dr. Jorge Prieto Health Center. I also have the honor to serve as the Vice Chair of the Health and Hospitals Committee, where I advocate for residents to gain greater access to our healthcare system. Today, we celebrate 50 years of community impact through the life and legacy of Dr. Jorge Prieto, an incredible leader, a servant, and an activist whose career as a physician made him a staple in this community. Dr. Prieto led us with trust, with empathy, and resiliency. And as an immigrant, he understood the importance of connecting directly with people in ways that honor their journey and recognize their struggles. In addition to Dr. Prieto, there were a number of people that made this 50-year possible. I want to first take a second and acknowledge those in the room that have been a part of this legacy. Are there any of our original members that were advocating for this in the room? I know I saw a few. There we go. Can we give them a round of applause? That doesn't just happen out of nowhere. It takes a lot of courage. It takes a lot of advocacy. It takes a lot of pushing in different levels of government to accomplish that. So I just want to acknowledge that. I also want to acknowledge, of course, the Prieto family. We have Carmen here. We also have Andrea Munoz, who is the executive director. I know she'll be speaking later. And I know these individuals and many of those in the room continue to be advocates and trusted partners in this work. We're so lucky that the passion of so many individuals for health equity continue to be our guiding light to not only do this for the right reasons, but to do it with compassion, with wisdom, and tenacity. Thank you also to the individuals that work here every day. We know we continue to make sure that bilingual services are at the forefront, and that is something that, again, it takes a lot of individuals to get it going. So as we continue to advocate for this type of services here, community-based services led with, again, compassion and with the goal of accessibility. I just want to, recommit and reiterate my commitment as a partner in this work here in Cook County. I'd like to make some quick remarks in brief in Spanish. Buenas tardes, me llamo Alma Naya, yo soy la comisionada del séptimo distrito y hoy es un honor estar aquí con ustedes celebrando 50 años de comunidad y bienestar. Es un honor para mí representar esta área del suroeste de la ciudad de Chicago, comunidades inmigrantes y también latinas. Y hoy específicamente estoy aquí muy orgullosa de celebrar estos 50 años. 50 años de impacto a nuestra comunidad que vimos y que continuamos de ver que han hecho muy buen trabajo aquí a través de la vida y también el legado del doctor Jorge Prieto, un líder, un servidor y activista cuya carrera como médico lo convirtió en pilar aquí en nuestra comunidad. Sabemos que hay muchas personas aquí que han hecho un buen trabajo, que continúan abogando y continúan hablando sobre la importancia del acceso médico en todas las comunidades. Y hoy estamos aquí, sí, celebrando 50 años, pero también comprometiéndonos de nuevo para continuar este tipo de servicio. Without further ado, I actually the run of show is not up here, but I will introduce, thank you. Sorry, the Congressman. Thank you. I'd like to introduce Congressman Jesus Triggers. Yeah.
Thank you.
And really quickly, I'd just like to acknowledge that Senator Selena Villanueva has joined us as well. Can we give her a round of applause?
Thank you, Commissioner Anaya. It's great to join some longtime friends, veterans of the fight for good health care for everyone who are all in the room here to celebrate the legacy, the continuing legacy of Dr. Jorge Prieto. This clinic started, of course, to serve the needs of the Spanish-speaking population and immigrants in particular over at 26th and Lawndale, and then we had the significant expansion here in 1997, I think it was, 96, give or take, when John Stroger had become president of the Cook County Board. So this clinic ensures that Cook County continues to ensure access to health care for people in their own neighborhood, in their own language, and appreciating their cultural needs as well. Today, we gather here to take note of what's happened and the many threats against our public health system across the country, the challenges that we're facing, but also to resolve to continue the struggle for universal health care like Medicare for all, and ensure that everyone across the country has access to it. And of course, speaking the language of people in communities where these clinics exist remains very, very important. It's of course also critical that we continue protecting the right to health care for all working families, and it is one of my priorities. This clinic has been of great benefit to me personally because my mother was a patient here. She loved coming here. She made friends with people like Jim Donahue, Dr. Fagan, see Dr. Ehrman in the back as well, anyone that she came across. Maggie Dolan, of course, as well. I think she just came in. So thank you all for your service, not only to her, but to everyone in this community. But protecting the care for all people and families is among my top priorities, and that's why I introduced the Protecting Sensitive Locations Act to implement safeguards against immigration agents and other federal agents from enforcing immigration laws in or near clinics, hospitals, churches, and other places that ought to be sacred for everyone, and where hands off by the federal government in particular should prevail, including schools and houses of worship at the same time. I also want to share with you a couple of tidbits about the Trump's so-called big, beautiful bill. We call it the big ugly on the other side of Congress, because this bill will significantly narrow the eligibility of health center program grants, threatening care for low-income, uninsured immigrant communities, while expanding dramatically the funding for ICE. And that's why I'm leading efforts to reauthorize and expand community health centers funding to protect essential health centers and ensure that our providers can continue serving patients regardless of income or immigration status. Because let's be honest, no matter what our abuelas say, not everything can be cured with Vicks Vaporub or a jarabe. Dr. Prieto Health Center, of course, has been here now for 50 years. And of course, he will remain an inspiration for all of us who fight the good fight for universal health and affordable health care for everyone in our country. Unos comentarios en español. Muchas gracias a toda la gente que se encuentra aquí celebrando el legado del doctor Jorge Prieto. Hace menos de un mes se honró el nombre del doctor y de Luz Prieto, su esposa, su querida esposa, en el pueblo de Evanston, la ciudad de Evanston. Así es que es muy propicio que en Chicago también estemos celebrando su vida, sus contribuciones y sus convicciones para asegurar dignidad en la área de la salud. Esta clínica surgió para atender a las necesidades de la población hispanoparlante, el cuidado con dignidad para todos los inmigrantes, y esa misión sigue viva a través de todo el personal que trabaja aquí, todos los voluntarios y voluntarias que luchan para que haya dignidad en el sistema de salud público en la región. La clínica garantiza que los vecinos del condado de Cook tengan el acceso a la atención médica en su propio vecindario, en su propio idioma y con todo el respeto a su cultura. La atención médica es un derecho humano. Sin embargo, como inmigrante, como latinos, a veces nos resistimos en buscar atención médica porque no hay suficientes profesionales médicos que hablen nuestro idioma y que entiendan nuestras creencias culturales. Por ello, hoy celebramos el legado del doctor Prieto y a la misma vez renovamos nuestro compromiso para luchar que haya justicia en la salud para todos y todas. Muchas gracias. Ahora quiero presentar en inglés State Senator Celina Villanueva, who lives about 6 blocks from here.
Chuy says that because I literally live 6 blocks south of him. Apologies. I just want to emphasize the issue that we all know, the lack of parking in this area. I was also a victim to it as well, and so that is an ongoing issue that I think we're going to have continuous conversations about, because we also know that if we're having problems with parking, we know our patients are having problems with parking.
Public transit is a solution.
Public transit is
We
also a
must divorce our
solution.
cars.
We're going to do both because it's all about finding a happy medium. Good afternoon, everybody. I'm State Senator Celina Villanueva, and I'm really happy to be here today. I am one of those Little Village residents who grew up in this neighborhood and who walked by on Pulaski and took the bus on Pulaski almost every single day. And the name Jorge Prieto was ingrained in my brain, very similar to the name of Rudy Lozano when we would go on 18th Street and go to the library in Pilsen. And these were always these famous figures in my mind growing up, because it was like, who are these people? What have they done? Because they're obviously really important if they have their name on a building. And later on in life, doing community work and organizing work, I got to meet so many people who have been a part of this, getting to know Carmen Prieto, getting to know about her love for her parents and their love for our community, is something that I think really ingrained in me, this idea of service and the need to continuously give back to our communities. And so being able to be here 50 years and celebrating this center, this healthcare center that has provided so much for people in language and culturally competent healthcare is so vitally important in the moment that we're living in right now, where healthcare is being taken away at every single aspect. And it's a fight of our lives, because healthcare is a human right. We know this. All of you in the room who have fought for so long, you know this. And it's something that you've passed on to the future generations, and we're going to continuously pass on, because it is a fight for our lives, because healthcare is our lives. It is who we are. It's literally ourselves. It's everything that makes us up together. But to be able to be here to celebrate the legacy of Dr. Jorge Prieto and Luz Prieto and for what they've done to the community, all I can say is thank you. Thank you for your contributions, Carmen. Thank you for your family's contributions to our community and the legacy that they've continued, but also to the legacy that you've all contributed to, because it takes a village in order to continue to do the work, but in order to continue this for 50 years and for another 50 years to ensure that we have a future parking lot, even though we do believe in public transit and expanding public transit, but making sure that we're meeting the services that the patients need every minute of every day. So I'm honored to be here today to celebrate this very momentous occasion and to continue the fight to make sure that we uplift the legacy of Dr. Jorge Prieto. Muy brevemente en español, soy la senadora estatal Celina Villanueva y es un honor estar aquí con ustedes hoy presente. Mil disculpas por estar un poquito tarde, porque yo, como muchos de nuestros pacientes aquí, desafortunadamente fui víctima de no encontrar estacionamiento y tener que dar vueltas como 5 veces, pero ya sabemos cómo está la cosa, y eso es una de las luchas, obviamente, que tenemos que seguir luchando para poder alcanzar hasta más servicios para nuestros pacientes y para la comunidad que viene aquí. Y es un honor de poder trabajar y reconocer el legado del doctor Jorge Prieto, porque obviamente su vida y la vida de su esposa, de su familia, es un legado de servicio. Y es algo que nos han dejado, que todos nosotros aquí en este momento presente también seguimos con ese legado de servicio, de continuar a servir a la comunidad y de ojalá expandir esos servicios, como lo que es el estacionamiento, pero también más servicios, de asegurarnos que el cuidado de salud sigue siendo en lenguaje que nuestra gente entiende, pero también que conocemos lo que es la cultura de nuestras comunidades aquí. So, un honor estar aquí con ustedes y muchísimas gracias.
And now we'll ask Cook County Health CEO, Dr. Eric Makaitis, to share a few words.
Thank you, Commissioner. Good afternoon, everyone. going to start with just a few words of thanks. First, recognizing and thanking President Preckwinkle, of course, and our Cook County Board of Commissioners, especially Commissioners Anaya and Lowry for their leadership on the Health and Hospitals Committee. Thank you as well to Congressman Garcia and Senator Villanueva, as well as all of our other elected officials who are participating. And thanks, of course, to everyone from the community, our staff, and especially the Prieto family for being here today as we celebrate a truly monumental occasion, the 50th anniversary of Dr. Jorge Prieto Health Center. 50 years ago, this clinic opened its doors with a simple but profound purpose: to provide high-quality, compassionate care to the residents of the Little Village community, regardless of their ability to pay. It was a mission born from the dedication of the clinic's eventual namesake, Dr. Jorge Prieto, a physician who tirelessly served immigrant and low-income communities. His family is here today, and I'd like to thank them for attending. Dr. Prieto understood that health is a human right, not a privilege, and that access to care should never be a barrier to a healthy life. Today, as we stand here celebrating this milestone anniversary, we're not just looking back at a half-century of service. We're also reaffirming our commitment to the very principles that this clinic was founded upon. The Prieto Health Center and our ACHN clinics throughout the city and suburban Cook County are an embodiment of the Cook County Health mission to establish universal access to the world's best care and health services for all of Cook County residents, regardless of ability to pay, so that everyone can live their healthiest life. The Prieto Health Center supports this mission in several critical ways. It provides universal access, it champions health equity through compassionate, culturally tailored care, and it builds healthier communities by tailoring that care to the needs of the neighborhood. 50 years ago, a vision was set into motion by Dr. Prieto. Today, that vision is stronger than ever. With our health centers across Chicago and suburban Cook County, caring for thousands of individuals, extending Dr. Prieto and Cook County Hospital's legacy throughout communities. The Prieto Health Center is a beacon of hope and a testament to the power of community-focused healthcare. To the staff, past and present, who've dedicated their careers to serving our patients here, thank you. Your work has saved lives and improved the health and well-being of generations. To the community and local partners, thank you for your trust and partnership. We're honored to stand alongside you in health. As we look to the next 50 years, we're inspired by the legacy of Dr. Prieto and the enduring spirit of this clinic. Healthcare is facing many challenges, but we take pride in the solid foundation that has been laid and the support we have from our officials, the communities we care for, and our patients themselves. We'll continue to build on that foundation, ensuring that Cook County Health remains a place where every resident, no matter their circumstances, can access the care they need to live their healthiest life. It's what Dr. Prieto envisioned 50 years ago, and it's what the county imagined nearly 200 years ago when the original hospital was built. Thank you again for joining us today, and it is my pleasure to introduce Claudia Burchinal, Executive Director of Ambulatory Care and Primary Care. Thank you.
Thank you, Dr. Macaides. Buenas tardes a todos. Soy Claudia Burchinal, la directora ejecutiva de los servicios ambulatorios de la salud primaria aquí en Cook County Health. Es un honor estar aquí hoy celebrando 50 años de servicios de salud en la comunidad. Hace 50 años el doctor Prieto tuvo la visión de traer la atención excepcional que brindaba en aquel entonces el Hospital del Condado de Cook directamente a la comunidad. Y hoy nosotros seguimos con su legado en nuestros centros de salud en la ciudad de Chicago y en los suburbios del condado de Cook. Esto reduce otra barrera que las personas enfrentan para recibir atención médica y también garantiza que las personas tengan acceso a una amplia gama de servicios más cerca de su casa, ya que no basta solo con brindar salud básica. Todos los residentes merecen recibir la atención de alta calidad que necesitan, cuándo la necesitan y dónde la necesitan, ya sea atención primaria, radiografías, análisis de laboratorio, control de diabetes o acceso a servicios que ayudan a las familias o a los individuos a tener una mejor vida y ser más saludables. Estos son solo algunos de los muchos aspectos de la atención que brindan nuestros centros de salud. Los centros de salud comunitarios son el motor que impulsa el progreso de nuestras comunidades. Y yo personalmente estoy muy orgullosa de ser parte de un sistema de salud que valora esto. Muchísimas gracias. Y ahora voy a pasar, I'm going to pass now to Dr. DeBiase, which is our lead medical provider here at Prieto. Thank you.
Great.
Hello, good morning. Good afternoon, guys. Okay, yeah. I've been working all day, so that's why. Okay, all right. So, yeah, okay, perfect. So, as I said, I am Dr. Norbert DiBiase. I am the lead physician here at Jorge Prieto Health Center. I have to also introduce my clinic manager, Alicia Mariscal, which is somewhere in the back. I don't see her. There she is, right back there. That's
there she is.
yeah, right in the back. Okay, so yeah, back there hopping. Because along with her, side by side, we're able to provide access to care to people here that we've seen for years and years, the little village community here in Chicago. A little bit about myself. I've been here for more than a decade. I've been a physician for more than 25 years, and I've truly embraced this city and this location, and like I said, I don't see myself leaving for a while, okay? Now, let's say less about me and more about the legacy of Dr. Jorge Prieto, okay? Perfect. Just think about it. If you look at back in the days, it was a small clinic on 26, correct me, Andrea, if I'm wrong, back over here. It grew, that way. Small clinic, and now we're seeing over 12,000 visits yearly here. And as of this fiscal year, we're at 11,800 plus visits. Okay, so the volume is here. Okay, maybe the parking is a different question here, but okay, all right.
We're trying to work on it.
We're going to work on that.
We'll do it together. Okay, perfect. So on behalf of the Jorge Prieto staff and so forth, the nurses, the assistants, the behavioral health team, dental, mammo, we're all truly grateful to the whole idea and the vision of Jorge Prieto, okay, the doctor himself. I want to say also that, as I said earlier, it's a pleasure and an honor to provide the care needed here for all these patients that walk through these doors down here below us. And from a toothache to a newborn and anything else in between, we see it here. I mean, everything. And I believe that Dr. Prieto himself would be very delighted to see how we expanded and grew this facility to serve the community that we call home. All right? So I want to thank you all for coming. I'm making it short. I'm not going to take any more of your time. I'm going to pass this on to the baton to the next person, which would be Mrs. Carmen Prieto. Okay? Muchas gracias por todo.
Good afternoon, everyone. Buenas tardes a todos. I'd like to acknowledge my other siblings who are here, my sister Lupe, somewhere back there, and my brother, Dr. Jorge Prieto, who also did his training at County and spent the rest of his career also training other orthopedic surgeons here at County. We also have my sister-in-law, Jorge's wife, and there is a granddaughter, Maggie, and I think there are 2 great-grandchildren here, Hendrix and Lola. So we are here. I am Carmen Prieto. I'm one of Dr. Jorge and Luz Maria's 9 children. Thank you for giving me the opportunity to say a few words today on behalf of my family. This is an auspicious occasion. It's hard to believe that it has been over 50 years since my father accepted the position as the first chairman of the Department of Family Practice Medicine at Cook County Hospital. He accepted the position on 2 conditions. First, he wanted to be able to choose his own administrator. He hired Carmen Mendoza, who was invaluable in helping the new residency program to succeed. 5 years later, when she left to help found the Claretian Medical Center on the city's southeast side, he hired our dear friend and community leader, Andrea O'Malley Munoz, who you shall hear from in a few minutes. Second, and most importantly, he insisted that Cook County had to establish neighborhood health clinics. If you will allow me, I'd like to read an excerpt from the eulogy that was given at my father's funeral in August of 2001 by Dr. Patrick Dowling, a beloved friend and one of his first residents. This is what Pat had to say. For the next 11 years, he forced the mammoth teaching institution to change by developing teaching family health centers in underserved and impoverished neighborhoods as model centers to train family doctors. It was in these clinics that he taught more than 100 young family physicians the lessons of the Sermon on the Mount, specifically as it addressed hunger and thirsting for justice. The goal was to train competent young family doctors and nurture their idealism to continue to spend their lives in service to the underserved once they graduated. As a result, the overwhelming majority of his graduates still practice in the ghettos and barrios of the city and across the land, as well as in Latin America and Africa. In doing so, he demonstrated that medical education can be socially responsible if it is viewed in the context of the community and distributive social justice. This country, which spends more per capita for healthcare than any other country, is still trying to learn from that lesson. I know that I speak what is in the heart of all who joined you early on in your pilgrimage at Cook County Hospital, from Carmen Mendoza to Andrea and Marcos Munoz, Doctors Reddy, Sethi, Dolan, Carney, Bass, Reba, Stocker, and Perry, and all the others that followed when I say muchas gracias and vaya con Dios. And tonight, I can hear you beseeching us like the words of St. Paul. Do not weep for me, but rather for the poor, the immigrant, those without hope, and then telling us to get out there and do something for them. 50 years later, these words still ring so true. My father was a humble man who, together with our mom, Luz Maria, devoted their lives to serving others. Together, they sought ways to serve those who could benefit from their help. My father taught others how he believed a physician should treat people, and he helped transform how Cook County delivered health care. In closing, I leave you with the last sentence in my father's book, Harvest of Hope, The Pilgrimage of a Mexican-American Physician. I've seen a few copies floating around, which is the story of my parents' life journey from Mexico to Chicago. This sentence reads, "It had been possible only because I had been sustained by the strength of a woman's faith and the beauty of her love." Thank you so much. Muchísimas gracias.
We would like to welcome Adelita Benitez, who is a patient here at Prieto, followed by Andrea Muñoz.
Aló, me llamo Adelita Benítez y yo estoy aquí desde que tenía 12 años. So I'm here since I was 12, and I met Dr. DiBiase. I'll tell you in a minute all the terrible things he has done. When I got here, I was like, 12. I hope that you're not good at math, so you don't know how old I am. But I got pregnant, and there is the dude over there. He's 15 now, and that long. And I'll tell you something quickly. The day that I came here, when I was pregnant, my baby was dying, and he noticed that. He said, "You got to go to the hospital because the baby is like, I suffer from diabetes, and it was drying out." I have no idea all of that, right? But he took care of it. He sent me to the hospital, and, well, he made it. He made it. So I appreciate your family. I do not know all of you, but the things you have done are like a benefit for me, right? And I appreciate with all my heart, and thank you. And it's a pleasure to meet you. And all because all you have done, you got such good doctors. You pay me later. And the nurses, only cash, please. Here's the nurses. I keep coming here, and he takes care of me. He sends me to all the specialists, and he's been a lot of help to me. And I really appreciate that, and because all the work that other people do here, I enjoy. I have a son, because I couldn't have no kids, but under his I hope we made it and I got one. So from my family, thank you, and it's an honor and a pleasure to meet you. And thank you. And thank you, all of you.
Please welcome Community Advisor Council Member Andrea Munoz.
Gracias y bienvenido a todo y buenas tardes. My name's Andrea O'Malley Munoz, Truth in Advertising. I want to say that Dr. Prieto was my compadre. He not only had a great concern about health care access, he was a very decent human being who cared a lot about justice for all people. Back during the days of the grape boycott, and even before the grape boycott started, he went out to California and marched with Cesar Chavez from Delano, California to Sacramento, because farm workers in this country were specifically excluded from all the labor laws. And even to today, California is the only state in this nation that recognizes the rights of farm workers to have a union represent them. That's where my husband first met Dr. Prieto. And then when Dr. Prieto was approached by Cook County Hospital to become the chair of family medicine, as Carmen pointed out, he said, only if you allow me to establish clinics out in the community. He said, you can't do family medicine in the tertiary health care medical center, Illinois Medical District. He said we'd end up doing primarily post-hospital visits. And if you want to do family medicine with continuity of care, you have to be out in the community where people live. And that way you can deliver the babies, give out the vaccines to the babies as they grow, take care of the whole family. And when mom and dad start to get older and get hypertension and diabetes, take care of grandma and grandpa too. And so, but he also felt very strongly that the clinic, he used to say all the time, it can't be a doc in the box. It has to integrate itself into the community. Now, he wanted initially to establish the clinic over in Pilsen, because his practice had been over that way, and he said he didn't want to see his patients lose a doc. He wanted to bring many more docs into the situation. He had for years been part of the Catholic Interracial Council, the support for the farm workers. It wasn't just health care on his mind. It was civil rights, the whole 9 yards. So, but there was a lot of competition over in Pilsen. There were a number of community groups. Little Village was just in the process of making changes. We had been a primarily Eastern European, Czechoslovakian, Yugoslavian, Polish community, and it was becoming Mexican. And it changed very, very quickly from 1970 to 1980. So there were several different community groups that each wanted him to start the clinic in their organization by their place. So my husband told him, nah, come over to Little Village. There's nothing over there. The docs on 26th Street are moving out to the suburbs as the Eastern European families were moving westward. And he said, nobody will give you any trouble because there's nobody here organized. So again, his concept was to do outreach into the community, to collaborate with other principals of schools, pastors of churches, directors of community organizations. And he wanted the docs to do home visits. He wanted them to have the full range of family to take care of. But also, we always would sponsor some sort of community events. We know that the county budget is going to be a very difficult budget process this year. The federal resources coming in are fewer than they've been. The state cut the HBIA services for the undocumented between the age of 42 and 64. So the demand for services, the need for access into care is going to be much greater as the resources become fewer. But there's great hope as long as we continue as a healthcare system to collaborate out with community organizations to educate people and to make it easy for people to become registered patients for the clinic. So events out at churches, at community organizations is a good way to establish that, and that would make Dr. Prieto very proud. So thank you for coming. It's great to be here today. When we dedicated this building, there are two things I wanted to mention. One, there's a picture that the clinic has here of Dr. Prieto standing in front of the front door. And what I loved about that picture is the reflection in the glass of the door of the houses across the street. So I thought that picture captured the sense of tied to the community, not just a dock in the box. The second thing has fled from my brain, but I'll say when we were starting it was my husband. The first patient ever seen at the clinic was my husband. The day before the clinic opened, he had organized a vacant lot cleanup here in the community and stepped on a rusty nail that went up through his shoe into his foot. We had just left the Farm Workers Union. Our pay had been $5 a week. We had no insurance. I was pregnant with our daughter, and I said, Dr. Prieto's clinic is opening up. Let's go over there, because I knew he'd probably never had a tetanus shot in his life. And we went over. It was actually the day before the clinic was open, but the nurse practitioner was stocking the exam rooms, getting ready for the big opening the next day. So she took my husband in and took off his shoe and pulled out the nail and cleaned it up and gave him a tetanus shot. So he got medical record number 1 given out here at the clinic. The other thing is that there was a precursor here in the community, the old bathhouse on 24th and Kedzie. There were 2 docs, one from county, Dr. Cooper, he was a cardiologist, internal medicine, and I can't remember the other doc's name. He came from Hinsdale Hospital, a Seventh-day Adventist, and he saw Thompson. You're right. Went to the bathhouse. It was actually at that point a model city's office from the city of Chicago that closed at 4 o'clock, and they'd go in every Monday and every Wednesday night, clean off 2 desks in 2 different offices, and they became the exam tables for running a free clinic. And that's where Dr. Prieto first started, and then those 2 docs came when we opened up the clinic on Lawndale. And for years, Dr. Prieto believed those evening clinic hours and then ultimately the Saturday hours that we added were critically important for workers that work a 7 to 3 shift in factories around. They needed to have access to have those evening hours. Ultimately, we added Saturday hours. But right before we opened up, Dr. Prieto used the farm worker organizing tool of doing house meetings. He asked my husband and I to have a house meeting and bring 10 or 15 people to the house from different blocks. And he brought Gail Floyd, who's here today, who was a resident at the time, and Pat Dowling. And our house was a 2.5-room house, so we had it out in the backyard. And he talked about what the clinic was going to be, where it would be, what the charges would be, what the hours would be, and so that people would know, because we said they'll be afraid to walk in because they don't have insurance. We're the youngest community area in the city of Chicago, And at that point, fully 1/3 of the residents in Little Village had no insurance, so they weren't used to going to the doctor. And then at the end of that meeting, you asked the people present to organize a house meeting on their block so we could spread the word of how to access the services. So that's a little bit of the history with Dr. Prieto. Thank you very much for your presence.
I'm sorry, I just want one more minute of your time. There's someone here in this room I have to acknowledge because my father loved him so much, and that's Jim Donahue. He was the social worker here, and there he is, there's Jim. A quick story, one year there were budget cuts and they came and they told my pops, they go, "You're gonna have to cut the social worker." He thought for about 2 seconds, he said, "Absolutely not." He goes, "You can take one of my doctor's positions, we'll find a way to make do, there were other doctors, but you cannot take the social worker." And they didn't. And also, Dr. Floyd, how he loved you. Thank you.
All right, so that brings us to the end of our speaker list. Thank you again to everyone for your words. Thank you all for joining us today to honor Dr. Prieto's legacy. Thank you. Yes, thank you. Thank you for the reminder. And we were joined by our Cook County Health Board of Directors member, Joseph Harrington. All right. Yeah, thank you.